Good evening, everyone. So, my next video, which I'm going to discuss with you, is on the topic hormonal contraceptives. And before I start my video, I want to request you, if you like this video and if it is helpful to you, kindly subscribe to my YouTube channel. That is Dr. Nitika Pharmacology Discussion. And now I'm going to discuss another topic with you, that is on hormonal contraceptives. In the female sex hormones, the topic hormonal contraceptives I'm going to discuss with you. That is the drugs which are used to avoid pregnancy. Now, contraception means interception in the birth process at any stage ranging from ovulation to ovum implantation. Means there is the process is inhibited. That is, ovulation is the interception is there. Ovulation is stopped, or ovum implantation is inhibited. That is the contraception. Means when we have to avoid the pregnancy. Contraceptives in current use, these can be combined oral contraceptives, progesterone only pills, emergency pills, that is postcoital or morning after pills, and centromon, which is the non-hormonal estrogen receptor antagonist. Now, combined oral contraceptive pills are of the estrogen and progesterones. These can be of three types: monophasic, biphasic, and triphasic. Monophasic is when the same dose of progesterone and estrogen is given during the cycle. And biphasic is when estrogen same dose is given, but progesterone for 1 to 10 days, low dose is given, and then from 11 to 21 days, the high dose is given. Triphasic is when estrogen is same dose is given, but progesterone 1 to 7 days, 1 to 6 days, low dose is given, 7 to 11 days, the medium dose is given, moderate dose is given, and from 12 to 21 days, high dose is given. Progesterone only pills, levonorgestrel is the tablet which can be given, which contains only progesterone. Postcoital progesterone only pills or morning after pills, emergency contraceptive pills. These are also of various types. So injectable contraceptives can be used. Like depot medroxyprogesterone acetate is the uh, injectable contraceptive. Estradiol valerate plus 17 hydroxyprogesterone captoate. Estradiol cypionate, medroxyprogesterone acetate. These can be given. Recent contraceptive methods, like there can be implants, like levonorgestrel implant is available. Intrauterine devices like levonorgestrel intrauterine devices is available. Hormonal contraception in males is there. Testosterone and androstenedione is there, and gossipol. Now, oral contraceptives combined, the ethinyl estradiol is the estrogen derivative, which is mostly given. And in the progesterones, levonorgestrel is the most common. Then there can be norgestrel, and then desogestrel. Monophasic combination pills. No phasic increase or decrease in estrogen or progesterone contained during 21 days of pill administration. First pill is given on the 5th day after the start of the menses, and one pill is to be taken each day consecutively for 21 days. The next 7 days are pill-free period, and the next course starts again after the 5th day of the menses. Means after the menses have started, 5th day से start करके 21 days तक we give. Then we wait for 7 days, and then again when the menses come, then we again start from the 5th day, and then we give for 21 days. Biphasic is the estrogens are given, fixed doses given for 21 days. Progesterone, which is given from 1 to 10 and 11 to 21 days. Higher dose of norethindrone is given. Like firstly 500 microgram is given, then 1000 microgram is given. Biphasic pills, these are, this is not biphasic, it is triphasic. So this same dose of estrogen is given, and triphasic 1 to 6 days we give 50 microgram, then norgestrone. Then 7 to 11 days we give 70 microgram norgestrone, and from 12 to 21 days we give 125 microgram norgestrone, and ethinyl estradiol is given same, that is 30 microgram. Oral contraceptive pills. Most blended preparations provide packet of 21 tablets only. Others provide 21 plus 7 extra pills, which contain either lactose or some iron preparation. If the woman misses one pill someday, she should take 2 pills next day and continue 1 pill a day as usual. If the pills have been missed for 2 to 3 days, then the course should be stopped. Mechanical barriers like condoms, diaphragm, or jelly should be used, and the next course should start from the 5th day of the menses as usual. Means when 2 to 3 days the tablets are missed, then we can give with the condoms, diaphragms, or jellies, and then we can start again the course from 5th day of the menses. Now, what is the mechanism of action of oral contraceptive pills? It is by the inhibition of ovulation. Means we inhibit the release of FSH and LH. Means we inhibit the release of LH. We give from outside estrogen and progesterone. So there will be feedback inhibition. So LH will be reduced. So there will be no ovulation. There can be a disruption of proliferative and secretory phases of the endometrium, reducing the chances of implantation of the ovum. And then we can also decrease the progesterogenic effects are, we can increase the viscosity of the cervical mucus so that sperm doesn't travel upwards and it reaches the fallopian tube, or it reaches the fallopian tube to get fertilized. And one another method of mechanism is we can inhibit the tubal motility. Tubal motility will be inhibited, so ova, which is released from the ovary, it will not be transported from the fallopian tube into the uterus, into the wall of the uterus, so there will be no fertilization. Now, what are the side effects of oral contraceptive pills? These can be estrogenic, like they can cause nausea, they can cause headache, breast tenderness, they can cause edema, they can cause withdrawal bleeding. Withdrawal bleeding or breakthrough bleeding can be caused. Progesterogenic effects are they increase the appetite, so they can cause weight gain, they can cause acne, hirsutism, decrease in libido, and rise in body temperature. These are mild side effects. Moderate are they can cause vertigo, leg cramps, uterine cramps, and precipitation of the diabetes. Progesterogenic are they can cause breakthrough bleeding. And when we give there is breakthrough bleeding in between the cycle, we can give the biphasic or triphasic pills to decrease that breakthrough bleeding. Monilial vaginitis can be caused, and there can be amenorrhea even after stopping the oral contraceptive. Severe there can be venous thromboembolism, cholestatic jaundice, gallstones, hepatic adenoma, myocardial infarction, and cerebral thrombosis can occur. Now, what are the contraindications of oral contraceptive pills? Absolute is when there is any thromboembolic or coronary or cerebrovascular disease, we should not give the oral contraceptive pills. Moderate to severe hypertension, hyperlipidemia. If there is hyperlipidemia, because they also alter the lipid profile, so in those cases also, and they also increase the BP, so they can be contraindicated. In liver disease, they can cause hepatoma, so they are avoided. History of jaundice during past pregnancy. Avert malignancy of the suspected or avert malignancy of the cervix, vagina, or breast, because they increase the chance of breast cancer, cervix cancer, and vaginal cancer. Porphyria, impending major surgery to avoid post-operative thromboembolism, because they cause the deep venous thrombosis, so these are avoided. Others are diabetes because they also impair the glucose levels. They cause the weight gain. So they're contraindicated in obesity, smoking, undiagnosed vaginal bleeding, age above 35 years, migraine, and gallbladder disease like gallstones, cholestatic jaundice, cholestatic hepatitis. So we can contraindicate the OC pills. Side effects, estrogens, they increase the risk of, they improve the endometrial carcinoma symptoms. Means the endometrial carcinoma is avoided by the estrogens. Progesterone, they increase the LDL levels, and progesterone, they also cause the resorption. They also decrease the bone mineral resorption, so they are can be given in the decrease the bone mineral resorption, so they are very effective in the osteoporosis also, and they're effective in endometriosis, in fibroids, and in endometrial carcinoma also, estrogens. And progesterones increase the lipid profile, so they're avoided in the myocardial infarction patients, in stroke patients, in blood pressure patients, these are avoided. In hypertriglyceridemia, these are avoided. Now, preparations available of oral contraceptive pills, these are Mala D and Overall L. Mala D contains ethinyl estradiol, norgestrol, and 7 tablets of ferrous sulfate can be given. Overall L is ethinyl estradiol and levonorgestrel. If pregnancy occurs during the use of the contraceptive pills, it should be terminated by suction evacuation because there is risk of malformations, genital carcinoma of female offspring, and undescended testes in male offspring. Because there can be malformations if pregnancy occur, and genital carcinoma of female offspring can occur, and undescended testes in male offspring can occur. Mini pills are the progesterone only pills given to those cases where estrogens are contraindicated. What are the conditions? Like if the age is more than 35 years, if the patient is of venous thromboembolism, or if the seizures are there, if the person is lactating, if the patient is lactating, then we can give mini pills. And pills are prescribed soon after delivery and continued without interruption. Mechanism is mini pills, they will increase the cervical mucus viscosity, and they will also place the endometrium prematurely to the secretory phase. Side effects of progesterone only pills are they cause acne, hirsutism, and amenorrhea. Postcoital are the emergency pills. These are the levonorgestrel, which can be given 750 microgram, and it has to be given. First tablet must be taken as soon as possible, and a second tablet taken after 12 hours. And it should be given within 48 hours of the coitus. And now the time has extended. It should be given within 72 hours of the coitus. Ethinyl estradiol and levonorgestrel, 2 tablets can also be given, and within 72 hours of the unprotected coitus, and after 12 hours again next 2 tablets are given, but it has less efficacy than levonorgestrel. Mifepristone 600 milligram tablet can be given within 72 hours of unprotected intercourse. And one more tablet is levonorgestrel 1.5 milligram single tablet can be given. And one more tablet is ulipristal, which is the selective progesterone receptor modulator. It's given as the 300 milligram, and it can be given within 120 hours of the unprotected intercourse. That is within 5 days we can give that ulipristal, and it is also postcoital pill. Now, centroman or loxifene, it is a non-steroidal estrogen antagonist developed at CDRI India, oral contraceptive under a brand name Saheli. Dose is 30 milligram taken twice in a week for first 3 months and then 1 week subsequently. Suppressed proliferative stage of endometrium, and if the menstrual cycle is prolonged for more than 15 days, pregnancy should be ruled out. Now, next comes the injectable contraceptives. This is the Depot, that is the medroxyprogesterone acetate, Depot Provera, same as mini pills. These are longer acting progesterone derivative, 150 milligram every 3 months, given IM. Useful in those where compliance is a problem, patients having heavy hair, menstrual bleeding, and in those in whom estrogens are contraindicated. Side effects are they can cause irregular or breakthrough bleeding, amenorrhea, anovulation, osteoporosis may occur on prolonged use. Gonadotropin suppression can occur, weight gain, increased risk of breast cancer, and if pregnancy should be terminated to avoid risk of congenital deformities. Recent contraceptive methods are Norplant and intrauterine inserts. Norplants are the levonorgestrel six capsules. They contain filled with 30 milligram of levonorgestrel for subcutaneous implantation inside the upper arm. If kept implanted, one set of 6 tubes remain effective for 5 years. Contraceptive effects are readily reversible with removal of implants. Mechanism of action same as mini pills, means they will increase the cervical mucus and they will also affect the secretory and proliferative phase of the endometrium. So it will be resistant to the implantation of this zygote. Intrauterine inserts, again levonorgestrel 20 microgram per day. It is released at the rate of 20 microgram per day for a period of 5 years. It acts locally, hence systemic side effects are less. Return of fertility is immediately after removal of these progestaserts. Contraceptive failure, enzyme inducers like phenytoin, phenobarbital, they can cause contraceptive failure. And these oral contraceptives, they undergo enterohepatic cycling. So when this tetracycline, it inhibits the enterohepatic cycling, so it can decrease the uh, action of the oral contraceptive, so leading to enterohepatic circulation doesn't occur. Blood levels in the of the oral contraceptive falls, so they can be contraceptive failure again. Non-contraceptive health benefits of oral contraceptives. These can be effective against ovarian cancer, endometrial cancer, fibrocystic breast disease, bleeding uterine fibroids. They can be effective against premenstrual tension and dysmenorrhea. They can also decrease the risk of ectopic pregnancy and pelvic inflammatory disease and endometriosis. They can Desogestrel is more safe for patients who suffer from weight gain, acne, hirsutism, raised LDL cholesterol, and they can be effective against in treating cyproterone acetate can be effective against treating acne and hirsutism. Now, hormonal contraceptives for men, these are spermatogenesis takes 64 days. The drugs which even completely inhibit spermatogenesis will take a long latent period to produce infertility. Similarly, return of fertility will be slow. So, gonadotropin suppression inhibits testosterone secretion as well, resulting in loss of libido and impotence, which is unacceptable. So, that is why we do not give the hormonal contraception for the men, because spermatogenesis also takes 64 days, and gonadotropin suppression inhibits the testosterone secretion as well, which will lead to loss of libido and impotence. Hormonal contraception for men is Gossipol, which is non-steroidal drug obtained from cottonseed, 20 milligram per day for initial 2 to 3 months, followed by 50 to 60 milligram per day as a maintenance dose is given. It should be used for not should use for more than 2 years, otherwise the turn of fertility will be difficult. Gossipol is the hormonal contraceptive. Drugs tried for male contraception are estrogens and progestins, androgens, superactive GnRH analogs, cytotoxic drugs, cortisol, and anti-androgens. Thank you. That's all for hormonal contraceptives. I hope you like this video. And if you like this video and if it is helpful and useful to you, kindly subscribe to my YouTube channel. This is Dr. Nitika, Pharmacology Discussion. Thank you. Be happy, be healthy, be blessed. Work smart. Thank you. Be happy. Thank you.